So today in this panel, we are very lucky to have Amy Rowland from the Emory Global Health Institute, Emory University, USA, Dilek Aslan from the Hacettepe University, Faculty of Medicine, Department of Public Health from Ankara, Turkey, Neville Kaleya from the University of Malta, Faculty of Medicine and Surgery, Department of Public Health, and Directorate for Health Information and Research, Ministry of Health and Aging, Malta, and Tina Purnat, visiting scholar at the University of Memphis School of Public Health, USA, and starting July, Doctor of Public Health student at Harvard University, USA. So first, I would like to thank you all for being with us today in this panel, and also I would like to thank everyone for joining us. Today with us, we also have Dr. Aleksandar Stevanovic, which you also see, who is working together with me at the Laboratory for Infodemiology and Infodemic Management, and of course, supporting us, Milos from the IT department of the Faculty of Medicine. So again, thank you, everyone. So my first question is a very general one, but it's interesting to hear. I would like to understand, how did you start working in the field of infodemic management and who supported you? And I will first turn to Amy Rowland. Well, Amy has 30 years of communication experience. She joined Emory University after working at the US CDC for 13 years in public affairs, communication science, campaigns, and emergency response leadership. At the Emory Global Health Institute, Amy provides strategic direction for new areas of growth, including directing Emory's partnerships with University of Belgrade to advance infodemic management curriculum and learning opportunities. So how did you first start working in the field of infodemic management? Who was there to support you?
Just realized I was still on mute. Thanks so much. So I have to say, you know, my business, since I started my career in public health at US CDC, has really been the information environment. As a public health communicator, a health communication specialist, when I started at CDC. And I came from the private sector, media and public affairs and advertising, so I really had a understanding already for how people consume information. So again, you know, the business of the information environment has been something that's been a part of my career as a public health practitioner. I have to say, I'm going to give you just 3 examples of how I know, you know, hearing about and learning about infodemic management, that it's really been a part of my journey, my career all along. When I first came to CDC in 2011, the first activation, emergency response, was Deepwater Horizon. So that was a major public health crisis here in the United States and the Gulf. And my job, I was part of a group of people at CDC that were advising and building a social media council at CDC in 2011. And my job on the response was to conduct social listening and understand what people's questions were, what people's concerns were, where there were gaps in information, and how we on the response could support the people's understanding of their risks and how they could access services and get their questions answered. So that was sort of social listening and the tools of and the competencies of infodemic management have really been a part of my career, starting back in 2011. And one of my, you asked who supported us. These are unlikely supporters for me. The director at the time, where the center where I was working, began referring to me as the folksy one. And I was the folksy one because I used to, my mantra was, we need to use words that people understand. We need to, understand communities and the gaps and how to make information relevant to them. So she influenced me, and I took that as a compliment. The next example is when I was recruited to lead digital media and content development for the Tips from Former Smokers campaign. And we all know in global health and in public health that the tobacco industry has a lot of money. They have a lot of resources and to manipulate the information environment. And so the campaign that I was involved in, we really had to be, we'd had a lot less money. We really had to be very strategic about how to counter market. And the digital media strategy became a very important part of that campaign. It wasn't in the beginning because there was no data to say, here's what works in terms of behavior change communication. Here's what works in digital. So I was so honored to be leading a team and a part of a campaign that developed, you know, the science, the evidence of how, you know, digital media is such an important part of engaging, meeting people where they are, and giving them, you know, the information that they need when they need it. And then I would say the last example is, you know, when I was my last position at US CDC, where I was in the Associate Director for Communication in the Global Immunization Division. And this is where I began to hear about epidemiology, infodemic management. My colleague, Liz Wilhelm, was working in the demand for immunization team in the same center where I was, a division where I was, and she was working with Tina, who is here today, to develop the framework and to host the very first conference on infodemic management. So I've always been an ally and a very big supporter, and I think my career is evidence of why we need to build the capacity and why we need to be prepared to work this way across disciplines and inside and out, engaging inside and outside of health.
Thank you, Amy, for your answer. And what I hear is that you have been working on improving the information environment inside of emergencies, but also outside of emergencies for more than 10 years. And I think that is something that we have to look forward to, or at least that is something that is our future. I will turn now with the same question to Dilek Aslan. Dilek's academic studies are on global health, community nutrition, aging populations, and tobacco control. So another topic Amy already mentioned. And since the pandemic, infodemic management has been a public health topic for her and a priority. And besides her academic studies, she is active in NGO activities. She is open to learning about new topics that the society needs. And I think this is something that needs to be a characteristic of all of us. So Dilek, when did you start working in the field of infodemic management? And what was your main motivation?
Yeah, thank you, Stefan. It is really very nice to be with all of you. When you asked this question, I went back to 2021, and it was, as we all know, the pandemic days. And as a public health specialist, I tried to produce and disseminate various informational documents during those days. And in fact, it was one of my social responsibilities because I was frequently producing something and sharing it with the audience in terms of public health. And I was using online and offline channels to spread the correct and updated information those days. As usual, it's one of our tasks, you know. And unfortunately, I came across much misinformation and disinformation about protective behaviors from COVID-19. They were so simple in our perspective, but it was too difficult to convince the people to change their behaviors. So the unwanted consequences of misinformation and disinformation about the protective behaviors threaten the lives of many individuals and the community itself. And it was not an issue of Turkey. It was the global problem. It was something very wide at the global level. The World Health Organization was one of the major information sources for me, which I frequently used those days. And I was also looking for a systematic and structured methodology to fight misinformation and disinformation at the individual and at the society level. I was thinking that infodemic management course of the World Health Organization would be a good opportunity for me. And Actually, I decided the course was announced, and I was just following up the website of World Health Organization. I decided to apply, besides my academic issues and other responsibilities. I applied and I was accepted and completed the course. It was the third course, and it was December 2021. In brief, combating misinformation and disinformation was my major motivation for this decision. And all journey started afterwards, and it's all combined with my previous background. And I'm so happy that I met all of you there in different times. And Tina was our leader in terms of in terms of the structured methodological journey. So I started like this, Stefan, and I think I will continue with your other questions. Thank you.
Thank you, Dilek, so much. And thank you also for turning towards our topic, and that is how we have built and how we can build a strong health workforce in the area of infodemic management. So now I will turn to Neville Kalea, and Neville is a public health physician with a doctorate in statistics. He had a 20-year experience working in health information, particularly at the national and European level, and he is also conducting assessment of health information systems in several countries in Europe. And I have to underline that I met Neville during my training on infodemic management, and he has been and always will be our Minister of Health, to which we always have to pitch our ideas and survive a very, very demanding but righteous questions and suggestions about our proposals. And I have to admit, after a few years now, that this has trained me to really think about these questions when I propose something and pitch something to stakeholders. So it has been really useful. So I turn to you, Neville, thinking about how we have built this workforce, how you started working, and how we have built this workforce of infodemic management.
Thanks, Stefan. It's been a pleasure at my end as well. And believe me, I always learn every course we give. I always learn more than I actually give. But coming back to the subject, so how it started. So as you said, I've been working in health information for several years. And being in public health in a small country, it usually means that you do a bit of everything, including we also typically engage with media, mass media, and social media in communicating with the general public on general, several subjects. And when COVID broke out, obviously, we were doing pretty much the same thing. We were trying to communicate with the public. We could sense, we had been monitoring in our own way, social media listening and regular media. And we could obviously sense the vacuum of information at two levels, actually, at professional level and at public level. And what obviously worried me even more was the vacuum at professional level. Because we needed to take decisions, and people were sort of trying to source information from everywhere, maybe not always, reasonable sources, because the information was so scarce. So this is to some extent sort of how I got sensitized. But when the point when it became very clear that to manage this pandemic, part of the management had to happen on media, including social media, was actually this incident, which I guess I have recounted elsewhere, but also for the purpose of our webinar, I'll recount it quickly again. So with this scarcity of information, we saw this page coming up on local Facebook, and it looked like a legitimate page, which was actually trying to share good information about the pandemic. And at first, actually, it started that way. The sources that started being shared on this page were legitimate, were good. Admittedly, many of us in public health, we sort of embraced this and we kind of endorsed the page because it was sharing right information. We were sort of also supporting ourselves with comments and stuff. Eventually, it started going a bit scary because this page started sharing only scary stuff, people dying and it really started scaring people, especially when it had actually gained a certain amount of membership. It started sharing scary stuff. And eventually, we discovered this page started sharing adverts for face masks and sanitizer being sold pretty much at the price of gold. And we tried to resist this, we tried to comment, we started being banned from this page. And it was very, very clear, basically, that this war had to be fought also online and in media. And I think that was a big wake-up call, not just for myself, but for the rest of the community in Malta. Were we prepared for infodemic management? I can't say we were. We were sensitive to monitoring media and trying to respond to it, but no, I wouldn't say we were prepared. So we tried, obviously, to hit the ground running as best as we could. Where did I get help at that point in time? Well, the training hadn't started yet. This was quite early on. So I must admit, I knew Tina from a previous life in health information, and I immediately reached out to her and to Tim and like, come on, like, where can we get info on this? I must admit they weren't the only two people I reached out. Being in public health for a couple of decades, I have quite a bit of an international network, and I started reaching out everywhere to friends in Asia, and that had helped a lot actually, especially addressing the professional gap in knowledge. Eventually, then, sort of I joined the movement. Can we call it the movement of infodemic management, led by the WHO very ably? And again, as Stefan was saying, I sort of brought with me here my experience in dealing with ministers. Now I've started my 8th minister. Okay, so I had 7 before. Now I'm actually into my 8th one. I'm glad that Stefan and other trainees actually found this useful. So yeah, that's really how it started. It is now very, very clear that even though the pandemic is over, we are seeing more misinformation spreading around the pandemic, and this is now threatening us in a serious way because it is creating even court cases reflecting on public health practices in the past. So, let's say the COVID infodemic is not over yet, but we're also obviously now much more sensitive to other infodemics. Reproductive health is one of the first that comes to mind. There's so much out there, so much misinformation around reproductive health because it's got all the right ingredients for an infodemic to be born. People with a huge thirst for information, okay, and therefore they tend to consume whatever comes along. But enough about me. Stefan, I'll turn back to you because I don't want to consume the whole hour.
Thank you very much, Neville, and it's really great to hear also how you started. And then let's say maybe for me a big enigma, and I have never asked Tina before. So how did you, Tina, start in infodemic management? And then I will follow right away with the second question, just to direct your answer a little bit. Considering your starts and what our previous panelists said about starting in infodemic management, what is the right way to develop a strong health workforce in infodemic management according to your experience by now? Tina is an accomplished health informatician whose global footprint spans over 2 decades of public health work. Tina believes in modernizing the business of public health means integrating cutting-edge technology and human-centered approaches to solving the world's most wicked problems. So Tina, thank you again for being with us. And I repeat the question. So I need to know, how did you start, or when did you see yourself really starting in infodemic management? And of course, turning back to our topic of strengthening the health workforce in this field, what do you think are the biggest challenges there?
Thanks, Stefan. That's a lot. I will try to unpack all of this. So, as you said, I'm a health informatician. So I come from information science background, but I've worked all of my career in basically every aspect of public health and health programming that you would think of. Prior to 2020, I was working at WHO leading health information systems and also worked in digital health. So some projects that I was leading used human-centered design to promote the use of health data that WHO publishes. But there's a whole area of work that also Neville alluded to in health information systems where how health information is not only produced, but also how it's used and informs decisions within the health system for public health policy and also for different communities. That's the gist of the work. So I also worked at that time on how to leverage big data for public health, and that's a vast field. Social media is a very tiny sliver of that. But that led me to sit on an advisory group of the WHO Vaccine Safety Net. This was a network of health authorities and vaccine advocacy organizations, and we were working together to try to use and analyze social media conversations in each of the network members' countries to improve the relevance and quality of the health information that they were providing and the way that they were working in communities, especially digitally. Then come COVID-19 pandemic, I was surged into WHO's COVID-19 response. And actually the first task that I got was to improve the analytics and evidence that fed into WHO's own risk communication work. So imagine, this was the dawn of the global emergency. It was a new virus, new disease, and that's basically where an emergency starts. But we knew that because this was potentially going to impact globally many different countries and different communities, we needed to have a fast and evidence-based way of quickly informing our own work and communication. I worked within the WHO EpiWin team, which was basically a group that was looking both at what evidence was coming out from epidemiological perspective, other types of data sources, and was then trying to inform the way that we would communicate and then also form different health guidance around the different topics. So the infodemic management was then formalized. I was supported by the then director of pandemic preparedness and response, Sylvie Briand, and the unit head for high impact events preparedness, Tim Nguyen. Along the way, we realized that this was such a total society event that normally in emergencies, you specifically focus on the first 100 days of an emergency response. But we knew that this is very likely going to drag on for a while. And that meant that a lot of the experience that I had and that the professional networks of people that I had and that we were building through the pandemic, we needed to bring on and draw on all of the ideas and expertise and the experience from what does it mean when you're approaching a problem that is actually a routine problem challenging the health programs, the health system, the policies. And this is where we also, in addition to supporting the COVID-19 response, later on other emergencies like cholera, mpox, etc., we also started looking at the information environment as the issue and the challenge that really basically pokes holes at every single vulnerability that you can possibly imagine when it comes to health information, whether it's misinformation, but also health information and the nature of evidence in health. So some of you mentioned the training that WHO that we organized, that my team organized through several cycles the last several years. Here's the thing. information environment is not challenging only the public communicators at the ministry. It's challenging the health worker, the nurse, the doctor, the pharmacist. It's challenging the manager of a program, vaccine program, nutrition program, etc. And that means that we have this duality. There's a need to introduce additional skills and competencies into the training of both future and existing staff that work in public health or in health context. But at the same time, we also need to be especially also focusing on public health practitioners in order to advance further systematic approaches to evidence-based intervention strategies in all aspects of public health, whether they are emergency related, infectious disease related, whether they're other aspects of public health. So the challenge is everyone feels overwhelmed, everyone that works in health feels the need that they would need to know something, but they don't know what to do. And everyone does need every professional profile that works in health. We need to develop tools and help every worker, public health worker, to also see how they can contribute to resolving this. It's not just a matter of, oh, let's just rely on health communicators, they're going to save the world. Actually, this is a public health problem. It's the problem for the health authority. It's the challenge to public health, to the health system in general. In my experience, what my advice is, there is no one way to do this, to introduce training. We need to empower and make every person that works in an aspect of public health, healthcare, to see what their contribution is and why it's relevant. Whether it's empowering and training healthcare workers to have quality conversations and having this and cultivating the trust with their patients, or whether it's, I kid you not, a health librarian at a university speaking to patients that just got a cancer diagnosis and are looking for to understand what kind of therapy the doctor just recommended, and a policy analyst who is advising a minister of health, who is getting tons of pressure to respond to some rumors or some statements that are impacting the policymaking process for public health. So I would stop here, but the reason also why there was such a diversity of people and colleagues that were admitted to the WHO trainings and future trainings and the partnerships on education that we have put together were so diverse, specifically because of this. Everyone that works in public health and healthcare has actually a role to play, and we need to show and chart the direction forward for how different professions actually can do this.
Thank you, Tina, for an overview and also for giving me some background information that I never got the chance to ask you, but I did it now publicly through this panel discussion. So we jump to a topic, and I would like to maybe continue in that direction in thinking about strengthening the health workforce. The question that you already answered, Tina, but feel free also to add later if you want something, to whom we should teach infodemic management and why. So I will go shortly to Neville if you would like to add something on this topic, and then ask the other panelists, what do you think? Who is the target for teaching infodemic management, and why do you think these specific groups? And Tina already gave a lot of examples. Who could be those populations and health workers, and even beyond that, who could benefit from infodemic management teaching?
I think indeed, as Tina to some extent was alluding to, the short answer to that is everyone. Because in reality, the opportunities that come along to communicate health information tend to actually go beyond the healthcare worker. So beyond the healthcare professional, beyond the healthcare worker, and even wider. Why should it not be educators? Why should it not be journalists? Why should it not be persons active on the media? So I would actually be careful in trying to limit the potential audience for infodemic management training. And I think it would be worth, Stefan, at this point, maybe also sharing some news, some very recent news. So I must thank once again Stefan's team for hosting a very important meeting last year in Belgrade, where we actually discussed the subject specifically. So it was a gathering of academics and beyond, where we discussed how we can organize, how should infodemic management training look like, and indeed, I think back to your question, Stefan, as to the who, if we look at the report, we actually have a number of, first of all, sort of, we speak about the generalist IM, okay? But we also see opportunities for engaging with people who are already specialized in their background. So we identify, for example, I think it would be worth just listing these 6 areas. We identify behavioral science, social media analysis, data analysis, policy and partnership building, health communication, and health promotion and health education. And again, please, let's not limit ourselves to just these 6 specialty areas. Definitely, for example, I'm a strong believer that this should be part of public health physician training. That's for sure, that's the very basic. But I think we should also definitely try to see that some elements of this enter at least healthcare worker training. So yeah, back to the original answer. I think the answer to your question really, Stefan, is everyone. And indeed, this publication, I'm not sure if Alexander has actually shared it also on the YouTube channel yet, but there's a link to the WHO website where this report of this meeting can actually be found. It also takes a sort of modular approach to how the training can actually be enriched with infodemic management skills. So anyway, I'll leave it up to our audience to have a look at the report, and hopefully, they take home some solid ideas how they can actually integrate such training into whatever training they are involved in.
Thank you, Neville, for your comment, and also thank you for mentioning, as the chair of this meeting in Belgrade. Thank you for mentioning our curriculum building meeting, and I'm sure Alexander or we will, by the end of this panel discussion, share the link to the publication which really came out just yesterday or the day before yesterday, where we were really the proud host with the support of the World Health Organization, but also our institutions that helped us work on the infodemic management curriculum, and also this sparked some partnership that I hope we will have the chance to mention here again. I turn to Dilek for the same question. Who do you think is the priority population for teaching infodemic management? Thank you, Dilek.
Thank you. I agree. There is no limit for this, for sure, because everybody needs the capacity of infodemic management. But as I'm working at a university, at a medical faculty, I started with the medical students because it was the quickest way that I would spread my background, which I gained during the course. I'm referring to infodemic management course. I immediately started with the medical students because during the pandemic days, I realized that medical students have insufficient information or capacity about COVID-19 and just struggling with COVID-19. The capacity of the students' use of the information sources was not sufficient as well those days, and it was not limited to my university. As far as I am concerned, it was similar all over the country. So I decided to give a start to all these lacking points at my university, and we started as the faculty member. We started with the first graders at the medical faculty. We integrated infodemic management courses into different levels of education, and we started with the first graders. And afterwards, we turned our face to the postgraduate education as well. The public health practitioners trainings, infodemic management was integrated as well. And we created the elective course opportunities for, again, undergraduate and postgraduate medical students and public health practitioners. But as Neville mentioned, it should not be limited to a profession. It should be for everybody. So what we did, we had collaborations with NGOs, and we also had collaborations with the medical and health professional organizations and institutions, and we just organized symposiums or other panels or other activities that everybody should be integrated and should listen and respond to their questions live or other opportunities. And the interdisciplinary or transdisciplinary feature of infodemic management allowed us to do this because many professions found themselves in infodemic management activities, not only the medical doctors, not only nurses. My university has many disciplines inside. I had the opportunity to integrate all of those other disciplines, and it was so fascinating to learn from their experiences and to exchange the experiences. And I think that it was so useful for all of us here in Turkey. And there is another opportunity for infodemic management is to spread the capacity at the national level, because the ministries or the public authority is also open to infodemic management capacity increase, because they need it as well. And this opportunity gave us to collaborate in terms of increasing this capacity at the national level as well. The public authority is aware of the infodemic and is open to increase its capacity in this regard. So it is good not to limit. In brief, it is good not to limit infodemic management to a profession, to just spread it all around, having the input of all the other professions, because of its openness to interdisciplinary or transdisciplinary feature of infodemic management.
Thank you very much, Dilek, and I'm also very, very proud when I hear the steps that you have done in your university, and then comparing that we have tried to do a very similar thing at our university with the great support of our department, even before our curriculum meeting in Belgrade, which gave us even more support afterwards. But even before that, with the support of our professors and teachers who have their own subjects, they saw this opportunity to integrate infodemic management at the various levels. So we also have the Bachelor or Integrated Studies of Medicine, the Master in Public Health, Master in Health Management, PhD in Public Health, and Infodemic Management is now something that the students at any level, it's a topic they cannot avoid, the topic of the information environment. And during our curriculum meeting, we were lucky to meet for the first time in person Amy Rowland. And to you, Amy, you know there is a common topic that we like to mention also, but let's start with a more general question. Where do you see the biggest challenges in teaching and mainstreaming infodemic management from your experience, and what do you see as the way forward?
Well, I would say our a really great ally that we should leverage are young people. And I happen to be at Emory University, where, you know, we have very excited and engaged young minds. And I think the biggest, you know, the thing that we should do is to create the demand for it, right? Because that will help. I mean, when you have a you know, university where you know, there's a lot of decision makers and to change and introduce new curriculum. I mean, there's, you know, we have to sort of be engaging leadership and decision makers and deans. But I have the opportunity at the Emory Global Health Institute, where we focus on experiential learning, to engage young people in case competitions and bring, and actually Emory Global Health Institute has the largest global health case competition in the world. We just hosted 31 teams at Emory, and a requirement to field a team is that it's multidisciplinary. You have to have, you know, you have to bring a team that has at least 3 disciplines on the team. You know, they compete to develop solutions to public health challenges. But they get it. I mean, they get this, young people. So I think that we need to you know, think of them as allies in terms of generating demand that this be taught. But again, you know, taking a step back in terms of engaging leadership at Emory through this university partnership program grant that we have, I wanted to mention that, you know, we are forming a council at Emory across all the schools to do the mapping, to look and to make recommendations at a high level for where infodemic management can be integrated into existing curriculum at Emory. So I think 2 things: create the demand with the stakeholder, right, the students, and the awareness of how it can be done, you know, if effectively, efficiently within existing curriculum. That's the place to start. And then again, at the Institute, we have this opportunity to, one thing we know about the model in terms of teaching infodemic management, we do the simulations, and it's the same with the experiential learning programs that we have. You know, we bring students in, we give them a challenge, we put them in an environment that sometimes is a you know, an emergency response type environment, or, you know, a public health challenge that's a burden, an emerging threat, or a big global burden. And you know, we put them in an environment where you know, they have to bring, you know, work across disciplines, think about the information environment, think about community engagement, and all the different things that are going to give them a winning solution. So, you know, I'm happy to be at a place where we sort of work at the intersection of education, research, and practice, to engage learners and leaders and talk to them about infodemic management and why, you know, it's important to build these competencies for the next generation of public health leaders. I was in a situation as a practitioner and as a supervisor at CDC where I could really see, you know, the gaps in terms of, you know, how we were teaching public health and the competencies that MPH students were coming out of, you know, Rollins into public health. So, you know, it's an opportunity to sort of bridge that gap. And there's a lot of conversation about, you know, teaching science communication and ensuring that we're building these skills, right? And I do just want to step back 1 second and say something that Dilek said. We have to start like way before they get to college. We have to start like teaching the media, you know, about media literacy, really at a very, very young age. So I agree with my colleagues that we shouldn't limit it, that we should really be teaching it across the disciplines, and we should be teaching it very young, you know, so that they're hungry for it, they understand it. So
thank you, Amy. And you mentioned Dilek, and I wanted to ask Dilek another question. So besides just first question that will go to everyone, that is, where do you see the biggest challenges in teaching and mainstreaming infodemic management? And you have talked about the first steps that you have made. So where are the biggest challenges? That's question number one for you. And then what are the reactions to teaching of infodemic management at your university, at your faculty? How do people, students, how do they react to that?
It's a new topic though, so this is something challenging because accepting new issues not be easy, especially for within the classic methodology. So integrate new issue is not an easy task. For this reason, introducing the need is just challenging, may be challenging, and you have to describe it very clearly, and you need to put the demand on the agenda. For me, the curriculum of public health residence program, for example, these were not these steps were not so easy for me, but when the people are convinced in the need, it is easier to go further. In my experience, people join academic management facilities have been happy to be a part of this global struggle, because they were aware of the global threats, and we had something very objective, the pandemic, and the infodemic was so prevalent, and it was threatening every person, individual life. So even in academia or in public, there was not so deep, because they got the importance the problem, and to be a part of the or management issue, they were happy, or they were eager to be with that point. And in this regard, partnerships are at the national and the international level, though. This was another important positive issue, the fact. National level, NGOs, health profession institutions, authorities, and the universities have been open to collaborating, and this was something good for us to just integrate infodemic and info management to the curriculum of undergraduate and postgraduate training, and the public as well. I know it's an easy task, and I'm aware that a long way, but fortunately I agree that all are promising for the future, because we have the capacity, all of us at the national and international level. We have to search also. We produce supplements in our national languages. This is so crucial to be updated and to be equal in information. We need to produce research, evidence, and reflect the results, the national results as well, to the national agenda of infodemic management. This is so crucial, and these are not so easy, because time is limited and our capacities are limited in some way. For this reason, we need to be so strategic, and we need to be so professional, and we need to join or collaborate our backgrounds, all of us, to go further at the international level, because infodemic is not an it's not a local issue, and it is even in non-communicable diseases. As Amy, I'm also interested in working in tobacco control, and there is a huge industry that we should struggle with because they're all producing infodemic. For this reason, maybe the pandemic experience have showed us that we can collaborate in acute, and also we can do it in chronic issues as well. So we need to go further, and the capacity of all of us is the opportunity for all of us as well. Hopefully I have answered your question, Stefan. Thank you.
Thank you very much, and I will turn out to Tina and ask. So, what do you think are the biggest challenges in teaching and mainstreaming infodemic management, and any comment for a way forward?
I agree with everything that colleagues have mentioned. Perhaps I actually maybe a bit to deviate from what was said, though, is that I actually do think that we do need to focus both on making connections and bridging to different professions, because public health is inherently a multidisciplinary practice. Anyone that works at the front lines knows this. We all work very interdisciplinarily. But on the other hand, there is something to say about building capacity for public health practitioners, because health systems have really chronically underinvested in many areas, but especially when it comes to even having the understanding, the expertise beyond public communication to understand how the information environment is really exploiting vulnerabilities and creating havoc in a lot of our professional activities and missions of health system. So the challenges that I see is, one, we need to be concrete enough so that when we are collaborating and when we're making bridges to different professions, that those professions can see those professionals can see what is their strength, what is their added value that they bring to the task. So, for example, when I speak to field epidemiologists, they have a very concrete task and context within they work with in outbreak response and investigation. So we're not going to be teaching them things outside of what they could actually implement during the task. So things that is important for field epidemiologists to learn is they're used to responding to a virus. Well, information is not a virus. It's a lot more complex. It's a social construct, etc. So bringing some of the social, behavioral, communication, digital aspects to it, and giving very concrete tools that a field epidemiologist could use. Same for GPs. Where they shine is with improving quality conversations with their patients, having digital skills to reach out and communicate in digital environments, and how to protect themselves from harassment and doxing in digital spaces, for example, etc., etc. So one, we need to be concrete enough to define what is the added value that a different profession brings. But on the other flip side, we need to be systematic enough to introduce health domain to researchers from other backgrounds that have their own frameworks, their own methodologies, for example, for research and for problem solving. But now, what does it actually mean when you apply it to the health context? And we all know that can create quite a lot of things. So, for example, we need to bring behavioral scientists and challenge them to be as applied as possible. Start by really understanding and defining the practical health problem, and challenge, for example, to do applied research, etc., etc. Those are the two things. We need to be working also in the future dual track, be as practical as possible. We need to introduce this to practitioners, especially the current ones, but at the same time be systematic, bring the multidisciplinarity in future researcher and practitioner work, so that we end up generating better evidence, better interventions, better strategies going forward. That's how we can really very quickly introduce this into public health practice and research. Thank you.
Thank you very much, Tina. I will turn with the same question to Neville. What do you see as the biggest challenges in teaching and mainstreaming infodemic management?
To be fair, I believe one challenge we might have to overcome is to actually dissect IM from COVID. Why am I saying this? We might even consider a name change to some extent to achieve that, whatever, I'll leave that hanging. But what I'm trying to say is, unfortunately, due to possibly fatigue and tiredness and whatever it is, the public out there, including the healthcare workers, including the academics, seem to not wish to hear about anything to do with COVID anymore. But therefore, I think one of the bigger challenges involved is to rebrand infodemic management. We know this, and we're maybe talking to the convinced here, but we need to make it clear out there that infodemic management is not something, it's not COVID. It's not to deal with COVID. It's something that maybe it should be a lesson learned from COVID, but to try and overcome this barrier, because we're seeing a lot of governments, and I see this in my network, disassemble infrastructure and development that happened during COVID. And in most cases, that infrastructure could have been much more useful if kept and used for other purposes. And unfortunately, infodemic management can be a victim of that culture. So if the more we can actually convince people out there that it is indeed a skill that is required, and I think the world is moving that way. I'm a bit unhappy to see that a lot of organizations are going for misinformation and disinformation management only, rather than actually investing in information literacy. But I think we're seeing more and more awareness. I think Tina wanted to add something to this, actually.
Tina, feel free to jump in.
Now, I absolutely totally agree with you. But I would like to remind us all that WHO did define infodemic management within the context of emergency and a link to health security. And that means that, if you look at the policy documents, resolutions, etc., there's been quite a lot of things published, for example, in tools related to measuring preparedness of countries in their capacities for future emergencies, for outbreak response, etc. WHO also updated the emergency response framework, so their own organizational framework that governs their incident management structure when there is an emergency, with all of this work. So, on the policy side, I think this is becoming part of the updated processes of the routine in the emergency preparedness world. However, I totally agree with you. And this is why I was talking earlier about information environment and the fact that we need to recognize this isn't only, a problem when an emergency hits, because actually the choices during an emergency response for dealing with information environment are actually quite narrow. And the challenge is, what do you do in the routine? How do you prepare for strengthening health programs and health policy effectiveness and guidance in routine, which is a different ballgame. And information environment should be as seen as a challenge, just like, for example, social, economic, commercial determinants of health. These are now the information ecosystem determinants of health, and that's something that we need to recognize. That's what I mean when I say it's a public health issue that goes way beyond a particular, obviously very well recognized challenge, which is emergency preparedness and response side.
Thank you for this addition, and I will just ask you all. We received one question. I saw some of you already responded in the chat, but for our audience that can see only the live stream, I will create something that I learned through the teaching or the courses of infodemic management, which is called fake duality. So if you could choose between teaching a lot of people a little about infodemic management or teaching a few specialists a lot about infodemic management, what would you choose in the realistic situation of very low resources that very often we find, or not all the time we find ourselves in? So I go to Amy first, and then I will ask everyone this question.
Yeah, I mean, if I'm forced to choose, I would say teach more. Don't have, a few specialists siloed and branded as infodemic managers. Really teach this across disciplines in terms of, how we need to work together and why bringing in these competencies and what, like Tina said, what it means for you, as a policy person or somebody who's studying law, for example, and wants to go into public health. Well, I mean, I mentioned my experience in the national tobacco campaign. That was a time where we had access to data, right? We were collaborating, and and Facebook and Twitter. I mean, they gave us access to the Twitter fire hose. It was not, a negotiation. They supported the data that we needed in order to have a successful public health campaign and to engage and to prove, the role of digital media in public health and as an intervention. But we don't have that situation now. So like Tina said, all the disciplines need to understand why this is important to the work that they do and how to work across disciplines. And I'll have to say, Tina, I agree, communication is not going to save the world, but we do need to be at the table when decisions are made, right? Like right from the beginning. And that wasn't always the case at US CDC. I was very fortunate to work in bubbles where we were empowered, but we have to be doing it, across the board and chronic and infectious in emergency response. So I say, my answer is, teach broadly, teach everyone, and, get support and broad understanding for what it is we need to do.
Thank you, Amy. And I turn to Neville with the same question: teach a lot, a little, or a little, a lot?
I think I'll be short. And I suggested an answer actually also to Alexander earlier. If I had the option and the budget, which is quite limited, I'll probably try to invest in training trainers. Because then I always, maybe I'm an eternal optimist, but I tend to believe that then those trainers, if they believe in what they've been given, they will probably find resources in their own setting to actually disseminate further. So if we choose carefully potential trainers and train them well, we can possibly see a perpetuating model then that will also reach the masses, so to say.
Thank you very much, Neville. And I asked Dilek now the same question. What do you think is the best way?
I think I agree with Neville. Train the trainers that experience in different public in my care, and it's training trainers. But on the other side, infodemic be integrated in regular life. I don't think that epidemic management should be separated from health literacy related issues. In public health preventive strategies, the primary and the primary prevention, which is effective, and actually in the prenatal prevention approach, at the society level, the education models should or might be changed, and infodemic management strategies can be integrated. So no need to create new methodology for informing all the community or the public. Just it may be a political decision as well. So this political decision strategies can help us for achieving just achieving the goal of infodemic management at the society level. on the other side, as I answered you previously, train the trainers is a good way to just make the model and to make it more scientific and evidence-based related outcomes.
Thank you very much, Dilek. And I left on purpose Tina for last for this question, as she was the one, at least for us, which were new to the field of infodemic management, although with some previous experience. But how do you see this training few with a little knowledge, or a few specialists, or train the trainers model? What do you think is the best way forward? And again, I ask you, as you have been able to create this incredible community of over 1,400 people who still exchange messages, work together, create new collaborations, and this field that has a life of its own, and I think in a way a very good life of its own. So how do you see this approach?
Well, Stefan, you basically summarized it. So I firmly believe that especially professionals who already have some experience, who have the training and experience in a particular field, those are the people that need to come together. And if you look at the types of the way that we had even organized WHO Infodemic Manager trainings, you know, a lot of it was leveraging the existing experience and the mix of the different expertise that the trainees already brought to the table. So experiential learning, the discussions, but also flipped classroom and collaboration in context is very, very important. So I do think that you know, no one training can download into anyone's brain everything that, you know, they would need to be, you know, an encyclopedic genius on this topic. But look at what happened. Everyone went away with a common language, a common understanding of the problem, but also possible solutions and other professions. And like you say, that's what pollinates further work and diffuses the work. I need to congratulate all of you and many, many other people in the network globally that have done incredible things, started university courses, worked through their professional associations, introduced roles, new roles and new units in their organizations. Etc. And then through this, teaching a little, many people, then, you know, you also can make more in-depth collaborations on things that you can do. So, and that means crazy things like, yeah, work with a lawyer so that they can also help you understand how do you deal with deceptive marketing in health. And, you know, work with a librarian that specifically looks at health literacy and media and information literacy, etc. So that's the game. I mean, we're in the long game. This is the challenge, in my opinion, one of the challenges for us, for the public health practice in our lifetime and probably beyond.
Thank you very much. I see Alexander again, and I have to use this opportunity. Alexander, you have been behind the scenes during this panel, but would you have anything to add or comment on? Because at least in our little local environment, you have always been a crucial part of developing infodemic management and all our activities that we have done.
Thank you, Stefan. It's just so satisfying to hear all of you and seeing we're coming from all parts of the world. And I know the unicorns are watching this from all over the globe, and seeing that we're sharing same challenges in different settings, but we are exchanging this experience, you know, taking lessons from each other. And this just means a lot to us. I know for you and myself, we learn so much by just watching other people do stuff in this field. So I think this kind of events and this kind of exchange is really crucial, especially when it comes to infodemic management, as people are now working in 2-3 languages, working remotely to the other parts of the world. So you cannot really work so specifically locally, but of course you should as well. So I'm really always honored to participate, and especially in these panels who gather really different continents, different countries, different backgrounds, and it's amazing. Your takeaway message. Teach a lot of people, make them curious, make them aware about the issue, and you never know where it's gonna go. As you plant a seed, probably, and then see it grow. And I think we're good seeds, and Tina was also a good gardener, we can say, and the garden is really now thriving. So I'm very glad, to see us grow, and I'm, looking over your success.
Thank you very much, and I will use this opportunity to thank all the panelists who have spent beautiful something over an hour with us discussing. And I'm sure I will be looking at what we said and what the people on this panel said about the future of strengthening health workforce capacity in infodemic management. And I also would like to thank our audience who watched us live, and really I'm looking forward to seeing other products and activities from all of you. And as we always are happy to see comments and activities of other unicorns and people working in making our information environment better, richer, helping us have better health and well-being. So thank you everyone for today, and have a great day and weekend.
Thank you.
Bye everyone. Thank you very much.
Goodbye. Congrats. Bye-bye.
Bye-bye.